Hi, I am Dr. Richa Sharma, Senior Fertility Consultant at Medica Fertility. Today I am going to discuss about premature ovarian failure, which can be a reason for early menopause in women. What are its symptoms, causes and the treatment? What is premature ovarian failure? Premature ovarian failure, that is POF, can be described as a condition when the ovaries lose their normal function of releasing a mature egg each month. Due to this, a woman diagnosed with premature ovarian failure may attain menopause earlier than the average age of menopause, that is before her late 40s, and by Indian standards, average age for menopause is 47 to 51 years. What are the symptoms of premature ovarian failure? The first symptom that is usually noticed is that of irregular periods, or patient may have missed periods. Other signs and symptoms are very similar to a menopausal lady, and they can be anxiety and depression, hot flushes, night sweats, low sex drive, vaginal dryness, painful intercourse, difficulty in conceiving, thus leading to infertility. What are the causes of premature ovarian failure? The causes can be hereditary, that is genetic. That means a woman who has a history of POF, that is premature ovarian failure, in a family might acquire this condition. Or it can be induced. It means if a woman has been exposed to some chemotherapy or radiotherapy or any other toxins or medicines which may be harmful for her ovarian reserve, and that may deplete the reserve early. Other causes can be chromosomal abnormality, some infections, surgeries, autoimmune disorders and hormonal imbalance, and it can be idiopathic also. How can premature ovarian failure can be diagnosed? It is diagnosed when a woman who is under 40 years has at least 4 to 6 months of missed periods, that is called as amenorrhea. And when she is checked for the hormones, she generally has elevated levels of hormones like FSH, that is follicle stimulating hormones, and LH, that is luteinizing hormone, and she will have low estradiol levels. Third thing, that if we check for a blood test called AMH, that is anti-Mullerian hormone, that will also be at a very lower level. And fourth is by the ultrasound, which will confirm the diagnosis, such that patient will have small ovaries with very few or absent antral follicles. What are the treatment options for premature ovarian failure? Treatment options can be hormonal, like if a female is diagnosed with this condition, she will begin hormonal therapy, that is HRT, to restore her loss of hormones in the form of estrogen and progesterone, and that will help in inducing the menstrual periods. Second, if a woman is suffering from infertility, then obviously we have to go for the donor egg, but before that we have to restore her hormonal imbalance. So depending upon the age of the female, treatment will vary. Third category is cases of cancer patients who may have a tendency to go for premature ovarian failure due to the effect of the chemotherapy and the radiotherapy they have been exposed. So in those cases, first thing we need to have team approach, and we need to take the help of the other specialties whichever is required. So proper counseling is very much required, and they should have the fertility preservation before proceeding for the cancer treatment. How can Medica Fertility help women to deal with premature ovarian failure? As you all aware, Medica Fertility clinics are among the top fertility clinics in Europe, but now also in India. With state-of-art technology and technical expertise of doctors, we have been helping women to deal with the fertility issues. We have treated many women who had been diagnosed with such condition, that is premature ovarian failure, and who had come to us to fulfill their dreams of motherhood. Fertility cannot be restored in them with their own eggs because of the lack of eggs. In that case, obviously we have to go for the third party reproduction, that is the donor egg IVF, to help them conceive successfully and have a healthy baby. Thank you for watching this video. If you have any questions or concerns regarding premature ovarian failure, you can drop your questions in the comment section. or call us on 786 2800 700.